compare it to others. And so we'd like to hear now from LA Christian or South Central, whoever would like to go first. If you could tell us a little bit about I understand you did patient satisfaction surveys, and some of you did focus groups. If you could tell us a little bit more about, how many you were able to complete. I know that you did it for 5 days, I believe, you generally speaking. Did any of the responses that you got confirm what you already knew? Tell us a little bit more about that, and if the information was useful for your organization, how you used it.
We at South Central collected 100 patient satisfaction surveys, and overall, our patients were satisfied with all the facility, the way the MAs treated them, how clean it was, and the only two items we failed was the weight. Usually the provider weight and then the weight in the lobby and in the room.
And that's not unusual. I think everyone could attest to the fact that generally wait time is where you get hit. Have you guys done any work around that in trying to improve your wait times, or do you see that in your future? Or?
We see that in the future, but we already knew that,
okay.
And we strive to change it. But our patients, although they know they're going to wait, they're satisfied knowing that they're going to see the provider they want.
Okay.
So continuity is very important.
Okay.
And even though we start to change, we still get pulled back to continuity, and that's where we
and continuity is very important. So thank you, Sharon.
We did two things. We did a patient satisfaction survey,
okay.
And we did one in 2009, we did one in 2010,
okay.
But the results for 2010 are not quite ready yet, but I was told that they're very similar to 2009.
Okay.
We also did a focus group that was done in January on one day when we had about 18 people in the community come.
Now, for your satisfaction surveys, was that for, like, what period of time is that for?
Well, we do about one a year.
Okay.
Is that what
So yeah, so you do it for like 1 month?
Oh, I'm sorry, 2 a year. Okay.
Okay. So like for a week period of time, do you know how long you collect them for?
We collect them for probably, I'm sorry.
100 surveys.
Well, in 2000, 100 surveys for people to Lisa. The thing is that we have 2 clinics
okay.
and outreach sites, so we surveyed all of them.
Okay.
So just sorting out people, Lisa was probably about 100, but the total for all these places was 464 surveys in 2009.
Oh, okay.
And then, probably a slightly lesser number, perhaps in 2010.
Okay. So the ones for 2010, that's something that was done outside of the collaborative, or is it something that your team did?
We have someone who has been in charge of it, and so he actually did the survey
okay.
and handed it out, and so he did it in 2009, so we repeated it in 2010.
Okay. Okay.
And he said it was pretty much the same, except the second time he added wait time for medication.
Okay. And what did he find?
He found that patients are very satisfied with our services. Basically, we went on a 1 to 5 point scale,
okay.
And so he was saying that for most of the things they were like in the 4.5 and above.
Mm-hmm.
So we covered such things as the appreciation for our support, the professionalism of the staff,
okay.
the caregiving by the providers, the medical assistance, we analyzed each of those, even our co-payment procedures and sliding scale,
Okay.
the facilities, and then 97% said that they would give us a 3 or better on a 5-point scale, and in terms of, well, let's see, most of our patients said that they would recommend their friends and their family.
And that's what we're looking for. That's key right there.
That was in our focus group. That was clear too. That they really loved it, especially our providers.
Okay.
Because they really feel the love and care that we give.
Oh, very good. Was there anything that you learned in your focus group that you could apply, that you could like make a change and make something
Well,
different?
they were asking for extended hours.
Okay.
Because we have a lot of working poor,
Mm-hmm.
and so they can't get. since we close at 5, if their work day ends at 5, they can't get there.
Right.
So we're now planning to open on Saturdays from 9 to 2
that's
to help
great.
those people out. And then on Thursday night, instead of going 8:30 to 5 like our usual day, we'll go till 7 when I
Okay, great, so you're using that information to inform,
Yes.
great. Josie, can you share?
Sure. In regards to the survey that we did, we actually obtained data first before we started the survey. We wanted to confirm our target population. So on a daily basis, we check the clinic schedule and identify our teens that were scheduled and then identify how many were coming in. And from that, we utilized an old survey and then we met as a focus group to identify what is it that we really want to find out from our population, our focus population. And we changed the survey. We did it for 1 week.
Okay.
And as I said, we obtained 29 responses or surveys.
Okay.
100% of all the ones that we gave to the teams were completed.
And from what I understand, your surveys were conducted one-on-one.
Yes, they
It
were.
wasn't like you just filled out a piece of paper, so if you want to
Right.
tell us about how that worked.
So what we did was we utilized our CHP marketers, and they would come down on a daily basis. We'd give them the clinic schedule, and we'd let them know the schedules for the day. And upon arrival, the staff, was prepared for the day to make sure that a survey was placed on the chart, and that all the providers knew that this patient needs to be surveyed at the end of the visit. And at the end of the visit, the surveyors were, as the patients were coming in, they were contacted and were waiting in clinic until they could talk to our
And you
patients.
got a yes from everyone? No one declined?
No one declined to
Okay.
survey. And all but 2 surveys, I think, were responded by the teams themselves, and then 2 were, I think it was about 2, right, Susanna? From the parent.
Okay, very
I believe
interesting.
they were 12 years old, possibly. Yeah.
So they're a little young.
Yeah.
So I have a question. I know there's a lot of talk about social media, and being that you're working with teens, did you ask them any questions about that, about using the website or using Facebook?
Right. Well, what we did discover is exactly, lots of things we discovered was exactly what we thought about teenagers. They're about themselves. They don't think about health. They come because they're told and so forth. And so we wanted to extract some information that if they had questions, where would they go? It was difficult to pull information from them. We really had to try to extract it from them. But the responses we did get, which were a few, they did say they would use the internet. One said they would go to their aunt, and all the rest just kind of, I don't know, I don't really ask, And I think they get it at school, but none of them said, I get it from school, or I come here, or I call, and so forth. And they don't, say out of, if 4 said they would look at the internet, but there were 29 kids.
Right.
I thought that was odd. I really thought that they would go to the internet and look at things if they really wanted to.
Right.
What they did say, and because we asked several questions about media, telephones, internet, if we had an email or web base for our center for your doctor, would you want to use it? And 26 or 27 of the 29 said that's what they wanted.
Wow, so they'd like to be contacted by the
Yes.
doctor, by email, or by
Yes,
text?
they would.
Okay, and I've actually heard, I don't have like the source or statistically exactly, but I've heard that teenagers, email is like obsolete and they don't, they'd rather be texted or something like that. That's the way they prefer to be contacted. So
And now
we're saying
with,
that's
yeah, right, and now with the conversion of email into text.
Right.
Yeah.
right, so they don't want to talk, they don't want to
They
like
just
have the
want
one-on-one, the
Quick
face-to-face.
answer, or I need an appointment,
Right.
and then it should be able to connect them, and then they can look real quick on a date and
Right.
so forth, and the hours that they want.
Right, and it's not only teens too. Actually, here, to get a cab, you guys may know this already, but you can text your address to Yellow Cab and they will text you back. And you don't have to talk to anyone, and a cab will come. So, I mean, we're, well, I know we're all liking that more and more, the non-face-to-face, but Thank you for sharing. So I know that, Rosie, you have like the contents of your focus group, the questions or the responses that you want to share. Do you have a copy of that for our studio audience? Or that you'll be able to leave at your station for?
Yes, we do.
Okay, that's great. Is there anything else you want to share? Because I know you gave an explanation of what you were working on. Is there anything else that you want to share about your focus group? Something interesting that you found out that stood out for you?
Actually, everything was really nice. They were very open about what they really wanted and needed. They wanted more care. And everything else was fine regarding the care.
Is there anything that they wanted that you're not doing that you can do?
Actually, the waiting time was.
Okay.
We even had a survey, and the waiting time was always a number 4 and number 3 on the survey. But we're working for that or towards that.
Okay.
Even we're going to have training in EMR, which is the electronic.
Okay.
And hopefully maybe then it'll be better, the time, but it was pretty good. We learned a lot too from the patients on the focus group, and we had a really good time
Okay.
knowing and understanding what the patients really want.
Yes, and that's important as we move on to talking about the attracting. But Monty, if you could just share with us from the call survey that you did out to your competitors, what did you find out that they're doing that you're not doing that you can do, you want to do?
Actually, first and foremost, the team realized that we need to meet the needs and wants of this market segment. Those two has to come together in order for us to gain the stations back. And what we found out from that survey is that their needs, they want the PE to be done, which will be including the vision and the hearing. They want their screening, preventive care screening, to be done timely. They want their immunization, complete immunization. They want their sick visit or same-day appointment. Those are the needs. The ones, they want a same-day walk-in clinic, same-day clinic. They want the friendly staff. They want short waiting time. They want multilingual staff. And they want competent staff. So the team decided, okay, how are we going to meet their needs and wants? So we came up with the customer service standards. Our customer service standards, it comprised of 5 criteria. We established courtesy as our first one, efficiency, safety, quality, and family and friendly environment. These 5 criteria embodies what their needs and their wants. So, courtesy, for example, I'm just giving you an example because it will be a long and lengthy discussion. So it will be, let's say for instance, courtesy. Giving the patient a friendly staff, providing them a friendly staff. We actually held an in-service to a pediatric staff, from providers to registration clerks to the nurses to the CNAs, everybody that works in the pediatric clinic. How we taught them, we told them, okay, first and foremost, you have to realize that in order for you to be customer friendly, you always have to wear that big smile. So introducing your name with a smile. So that's the first thing. Efficiency. So we implemented and reinforced the redesign. Redesign is every 2 doctors, there should be 1 licensed nurse, 1 NA, 1 registration clerk, so that the patient has a short waiting time. So it actually related to everything. Right. So short waiting time because the cycle time, if everybody works as a team, so we can get the target goal of 60 minutes for the entire visit, starting from the registration down to the discharge. So safety, we want to make sure that the patient feels safe in our environment. So there's surveillance rounds, our clinic area, our waiting area is safe enough for pediatric patients from 0 to 18. Quality, we want to make sure that our staff are competent. In-service, mandatory clinical in-service. The providers, they have their peer review every month. The nurses, they have their skills validations that has been done by the nurse managers or the nursing director. family and friendly environment. This part we're still going to work with because we don't have that budget yet. But hopefully when we can get the 6,000, we will be able to buy our posters, our reading materials, our magazines in our pediatric waiting room.
Okay.
So that will be our main goal. So we're still working on it, but we are there.
Thank you. I mean, it seems like you dug so deep. You went back even to redesign and figuring out, going back to the care team model and making sure that you can be more efficient. So it sounds like really good work. Which brings us to our next commercial from our sponsor, JWCA.